The coronavirus pandemic reached Niger on the 19th of March 2020, when the first case was reported. It proved to be a tough blow to the local healthcare system. One of the biggest challenges was to maintain the provision of care and services at the health facility level during the crisis. A national plan was implemented with the financial support of various partners to deal with this humanitarian crisis and interrupt the spread of the virus. At operational level, various mechanisms have been implemented to ensure the continuity of medical care and services. This plan also included major actions aimed at the community, because the community is at the heart of the fight against the COVID-19. As humans are carriers of the virus, it is crucial to mobilize communities regarding best practices to contain the spread. At the community level, emphasis was placed on training community relays to conduct awareness-raising activities on COVID-19 during their services. Therefore, communication campaigns focused on the risks and the responsibility of the communities have been carried out to raise awareness and encourage the population to adapt preventive measures that help prevent the spread of the virus.
I came here to share some information about that new disease called COVID-19. It's affecting the whole world. During our awareness-raising activities, we attract people's attention on preventative measures against the disease. I'm in charge of educating women during parental consultation, and especially regarding vaccination, which is also important in protecting children from diseases. I also attract their attention on why it's useful to often clean hands with water and soap, one of the preventative measures to deal with the coronavirus.
One of Niger's strategies to maintain the provision of services at the operational level within the COVID-19 reality has been to maintain ambulatory activities and mobile clinics, which helped reach underserved communities located more than 5 kilometers away from a healthcare facility.
I've heard of this pandemic. We were informed thanks to healthcare workers along with various sources in our community. To prevent the coronavirus disease, we must take protective measures. For instance, we need to wear masks and clean our hands with water and soap. I think such measures make sense. They're aligned with best practices. The access to the healthcare facility has been maintained while implementing certain preventative measures, such as physical distance, especially in the waiting room, which shouldn't house more than 5 patients at a time. The things that impressed me the most were the need to wear a mask and maintaining physical distance.
One way to protect ourselves against COVID-19 if we don't have a mask is to use a hijab, which covers our mouth and nose. In the Agi Health District, support mechanisms have been implemented to guarantee the continuity of the provision of medical care and services.
The implementation of the COVID-19 contingency plan allowed us to maintain our services. In particular, we've added a place to wash hands at the maternity's entrance. Awareness-raising campaigns have also been carried out so that social distance is adhered to. We made sure every woman coming for a consultation was wearing her mask. We also have equipment that can be used in the everyday work, such as masks, alcohol-based gel, a place to wash hands, and a temperature-checking device that doesn't rely on physical contacts.
Implementing a contingency plan has made it possible to keep on offering care and services, especially in the fields of maternal and child care in the facilities that implemented it. The number of services has not decreased overall, and in some cases were actually higher in 2020 than in 2019. At the central level, the strategies developed have made it possible to draw conclusions regarding how to deal with the crisis.
We've ran into some problems, but nothing major. Regarding washing hands, it took a bit of time for people to understand that they need to clean their hands before being able to access healthcare services and treatments. It was also tricky to get people to wear masks since they're not used to doing it. But with time, that behavior became natural. We're also struggling with resources. Equipment has to be made available on all levels.
At the central level, the strategies developed have made it possible to draw conclusions regarding how to deal with the crisis.
COVID-19 has turned the world upside down. True, but that same world has also learned a lot from it. We're never ready, per se. We've seen that there's a lot of work left to do in our healthcare system.
The staff succeeded in guaranteeing the availability of essential MNCH nutrition services at the various health facilities with support from the government. That made it possible for us to reach our community and raise women's awareness. We wish to call out to executive management in charge of reproductive health in order to expand that mentoring and tutoring strategy, because despite the pandemic, these services have been 100% maintained.
Thanks to the establishment of the contingency plan, along with the coordinated implementation by all relevant players of the right strategies in terms at the health facilities and awareness raising in communities, the system proved resilient and able to ensure the continuity of both the provision and use of key services and medical care for mother and child.